Herpes viruses, which includes human herpes viruses 1 to 8. Introduction. Family Herpes viridae is divided into 3 subfamilies, alpha, beta and gamma. Herpes viruses, they are icosahedral in shape with 162 capsomeres and they are about 150 nanometers in diameter. They have a double-stranded DNA and a lipid envelope. The lipid envelope is derived from the nuclear membrane of the host cell. The space between the nucleocapsid and the lipid envelope is known as tegument, and it contains viral proteins and enzymes that help in initiation of replication. The herpes viruses multiply in the nucleus of the host cell, producing Cowdery type A inclusion bodies. The 8 herpes viruses infecting human beings are divided into 3 subfamilies, alpha, beta and gamma. The alpha herpes viridae contain human herpes virus 1, 2 and 3, which are respectively herpes simplex virus type 1, herpes simplex virus type 2 and varicella zoster virus. The beta herpes viridae contain human herpes viruses 5, 6 and 7. 5 is cytomegalovirus, 6 is human T-cell lymphotropic virus and 7 is RK virus. The gamma herpes viridae contain human herpes virus 4 and 8. 4 is Epstein-Barr virus and 8 is Kaposi sarcoma associated virus. All the herpes viruses, they have a primary target site where they infect, and they have a site of latency where they remain for many years in a late stage of latency. For human herpes simplex virus type 1, 2 and for varicella zoster virus, the mucoepithelial cells are the primary target site and the site of latency is the neurons in the central nervous system. For cytomegalovirus, monocytes and lymphocytes are the primary target site as well as the site of latency. For HTLV and RKV viruses, T cells are the primary target site as well as the site of latency. For Epstein-Barr virus, B cells are the target site as well as the site of latency. For Kaposi sarcoma associated virus, endothelial cells are the primary target cells and the site of latency is vascular endothelium. Herpes viruses, this is a schematic diagram which shows the nucleocapsid surrounded by the tegument, surrounded by a lipid envelope which contains glycoprotein spikes known as peplomers. This is a schematic diagram which shows the pathway of the herpes simplex virus during latency. They infect the mucoepithelial cells and from there they travel through the axon to the neurons in the central nervous system. And during latency, they will remain in the neurons in the central nervous system, and when reactivated, they will come back to the same axons, to the same site and cause infection. This is another diagram which shows the same thing. The herpes simplex virus travels through the axons to the central nervous system, and during reactivation, they will come back to the same pathway and cause lesions in the same dermatome which they had infected initially. Herpes simplex viruses type 1 and 2, the name is derived from the Greek word meaning to creep. The lesions are also called cold sores. In pathogenesis, the primary infection occurs through the skin, oral mucous membrane or eyes, resulting in vesicle formation. The vesicle contains multinucleated giant cells and eosinophilic intranuclear inclusions, along with inflammatory cells and cellular debris. The incubation period is 5 to 6 days. The infection of herpes simplex viruses is divided into 3 types: primary infection, latent infection and recurrence. The primary infection, virus replicates actively in the skin or mucous membrane in the vesicular lesions. In latent infection, the virus will travel through the axons and go to the central nervous system. In the central nervous system, the viruses will settle down in the neurons in the sensory ganglia. In case of herpes simplex virus type 1, the trigeminal nerve is the site of latency, and in case of herpes simplex virus type 2, the sacral nerve is the site of latency. Recurrence is activated by the following factors: stress, trauma, fever, sunlight, menses and some foods. In recurrence, the viral travels back down the same nerve route and reaches the same dermatome and at the same spot each time, causing lesion each time. The diseases caused by herpes simplex virus type 1 and type 2 are shown here in this table. It is So that herpes simplex virus type 1 causes lesions predominantly in the upper half of the body, and herpes simplex virus type 2 causes lesions in the lower half of the body. The lesions of HSV1 include gingivostomatitis, herpes labialis, keratoconjunctivitis, dendritic keratitis, eczema herpeticum, encephalitis, and genital ulcer. The lesions of herpes simplex virus type 2 include genital lesions, neonatal herpes, cervical and vulvar carcinoma. The complications include herpes encephalitis, which is mostly caused by herpes simplex virus type 1, herpes meningitis, mostly caused by herpes simplex virus type 2, herpetic keratitis, which is uniocular. It is an important cause of corneal blindness. Herpetic whitlow, which is infection of the fingers, which is often seen in doctors and nurses who attend the patients of herpes simplex virus. Herpes gladiatorum is an infection of the body occurring through the cuts or abrasions in the skin acquired during wrestling. Neonatal herpes simplex virus infection acquired during passage through the infected birth canal of the mother. It is fatal. Cervical carcinoma, HSV2 has been implicated in cervical and vulvar carcinoma. In epidemiology, the disease is worldwide in distribution. There is a phase of latency in all the herpes simplex virus infections. The infected person is a lifelong source of contagion. Transmission occurs through direct contact with a vesicular discharge, perinatal transmission, and congenital transmission. In lab diagnosis, scraping from the base of the vesicle or vesical fluid, a serum is taken for serology. When smears are made from the scrapings from the base of the vesicle, multinucleated giant cells can be seen in the microscope, which are known as Zhang cells. These Zhang cells, they show intranuclear inclusions, which are known as Cowdery type A inclusion bodies, which is a characteristic feature of herpes simplex virus infections. In culture and isolation, human embryonic tissue, HeLa cells, or chorioallantic membrane can be taken for culture. Virus produces effect, CPE effect, within about 1 to 3 days. The infected cells become enlarged and appear ballooned, and some isolates also cause syncytia formation. In serology, complement fixation test, neutralization test, and direct immunofluorescence test can be performed. This is the diagram which shows the lesions caused by herpes simplex virus type 1 and type 2. Cold sore, herpes gingivitis, herpes gingivostomatitis, herpetic whitlow, and genital herpes. With this, we finish the part 1 of herpes viruses. Thank you.